In this video, we will discuss about one of the malaria treatment mechanism. So, first we will discuss about how this parasite that is responsible for malaria works. So, this Plasmodium parasite does not has the capacity to produce its own amino acid. So, from where it acquires the amino acid that is required for its energy or its function. The parasite gets its amino acid from hemoglobin. So the breakdown of hemoglobin into amino acid and ferri uh, protoporphyrin 9, which is toxic component, or we can say it in short term as HAME. So in normal form, what happens is that this toxic component will polymerized and form into this toxic component under the effect of pH will become non-toxic and converted into the uh, polymerized form called polymerized heme. With time, this process of converting the toxic component into the polymerized heme happened. However, what happens is that in case of malarial treatment, the chloroquine is injected. The chloroquine does is chloroquine uh, prevent the polymerization of this toxic by changing the pH. So what happens is that this accumulation of toxic component will continue to occur within the Plasmodium parasite, and eventually what will happen is that it will lead to breakdown of this parasite and the cell death. This is one of the way how this uh, parasite that is responsible for malaria can be treated, or this how this parasite can be made ineffective or death by inhibiting the reaction to convert this heme to polymerized heme. So this is same thing is mentioned here, is that hemoglobin is converted into the heme, which is toxic, and then it is polymerized into the hemozone or polymerized heme. However, there are some ways by which this malaria gets resistance towards this chloroquine. So two ways are mentioned here. One is PFCRT and another is PFMDR1. So I'm not able to recall the full form. You can go through the reference that is provided in the description. So what it will does is it will prevent the formation of chloroquine. So because now the chloroquine is not available in sufficient amount, so uh, the effect of chloroquine on this plasmodium will be diminished. So, or in other way we can say that the if the same amount of chloroquine is injected on the left side condition and the right side condition, the right side condition will uh, work like chloroquine resistance plasmodium, because now it contains this PFMDR1 and PFCRT that can prevent the formation of chloroquine, and the red dot indicates that this thing has already been proved. And there are some other examples are also mentioned here that is inhibited, like SUL, PYR, PRO, ATO, and this will also promote this will also promote the survival of plasmodium, thus makes this malaria, and we can say anti-resistance towards this kind of drugs, uh, that is chloroquine or MEF. PFMDR1 will also makes the plasmodium resistance towards this MEF, and this ATO work similar to the chloroquine. That is, it will prevent the formation of heme, or we can say in the work that is done by chloroquine in the uh, food vacuole. The same work is done by ATO in the plasmodium mitochondria. If you need to understand more about this anti-drug resistance and this malaria treatment, you can go through the uh, reference that has been provided in the description. That's all for this video. Thank you for your time.